So welcome to our show. We're joined by none other but the legendary Keith Campbell. Keith.
Great to be here.
Keith is probably, when you say diabetes and pharmacy in this industry, people think of Keith Campbell as the main person. He speaks around the country, he consults, and we're so fortunate he's been on our advisory board for many, many years, and he helps guide the articles that we do that have to do with pharmacy. And it's great to have you.
It's good to be here.
Let me ask you, because we're writing an article. There was a doctor, pediatric endocrinologist, that was putting his overweight kids on Adderall and maybe metformin, and they were losing the weight and feeling good. Of course, Adderall is speed. It's a mixture of amphetamines, and
Yes.
But he said, people criticize that, but he said, look, there's nothing else that works, and my patients are losing the weight. What's your reaction to that? Why wouldn't adults go on Adderall to lose the weight to get rid of the diabetes?
Well, if it works, then I think it's a good idea. Remember, with drugs either speed up or slow down normal physiological reactions. So if you speed up normal physiological reactions, you're going to have some side effects. If you slow it down, you're going to have some side effects. So there's always the risk. What's the balance between the effect and the side effects? Mm-hmm. And that's a good way to look at drugs. So if the side effects are greatly outweighed by the impact of the drug, then we're willing to tolerate that a bit. And I think people who think that way, like this physician, are doing everybody a service to kind of check that out. Mm-hmm. Since Adderall isn't approved for weight loss in children with diabetes, there is a little bit of legal risk and so on, but the thinking makes sense. Mm-hmm. And other drugs that, approved in Europe, but Rimonabant, we were all excited because it blocked the effects of marijuana. It's a cannabinoid inhibitor. And the average person lost 14 pounds on it. But 20% of the people got kind of depressed and had psychological effects. So the government said, nope, we need 2 or 3 more years of study.
Right.
So here it's available in Europe. People are losing the weight with it. They lose their desire to smoke, and it decreases insulin resistance. But it's going to be a while before that drug's here.
Marijuana?
Any cigarette.
Oh.
It's a great drug for reducing smoking.
But it's not available here yet?
No.
Okay.
And the reason is that it had this side effect profile, and we want to applaud the FDA for saying, let's be safe rather than sorry, especially in the environment of, Vioxx and some of the other things that have embarrassed the FDA because they were approved and then later something happened.
Something else that I think is helps exercise.
Yes.
And you've spoken to me about this before privately, is Cialis, Levitra, Viagra. And I've never really seen people say guys with diabetes should be having more sex and this helps. And what's your take on that?
There's nothing wrong with sex. And I was brought up the more the better, and all that. No.
Child of the 60s right here.
Yes, but what's really important is that, again, when you look at the 3 drugs, all the studies that I've seen, if you have a man who's tried all 3 of them, mm-hmm. over 75% choose Cialis. And the reason is that you don't have to worry about the timing of it.
Right.
You can take it. It isn't affected by food. It isn't affected by alcohol. And you have up to 36 hours. So, if a man takes it and he says to his wife, gee, isn't that the same sweater? Why'd you buy that one? So, if he's on the other drugs, he's just wasted his money,
Right.
But with Cialis, you have time to be nice and be romantic and maybe have another chance. Or if you're in a really amorous mood, you might have 3 or 4 chances.
Ooh.
Okay, over a weekend.
And there's no problem with people with diabetes.
No.
It doesn't. No. My one doctor said it's actually healthy. It increases blood flow to your heart and like a vitamin.
Yes. Well, it's good. I mean, it's good to be healthy, and it's good to be happy. But it's also good to realize that if you're in that situation, you're treating both the patient and the patient's spouse.
Yeah.
And so you want to make sure that they both understand that good communication and little romance, and you know, you don't just take these things and go plunk my magic twanger froggy. I mean, there has to be romance, there has to be foreplay, you know, and so it's.
I know we can talk about this for hours. Donna Rice, who's this year's president. Came to San Francisco, and that's what she does. She talks about sexual health, and she said when she started, people wouldn't even let her pass the flyers out. It was such hush-hush.
Yes.
And Viagra has actually caused this, that you and I can even talk about this, wouldn't have happened 10 years ago.
Yeah. The little blue pill, you know, you see it on TV shows, and
we've come a long way.
Movies, and it's, but you know, any disease state or any, you know, what happens to men, you understand what happens why they don't get an erection, especially diabetic men?
Tell us.
Okay, their blood vessels get damaged throughout their body.
From neuropathy.
Okay, and so, well, the nerves are damaged, but also the blood vessels themselves, the intima, the inside lining of it, the endothelium is another term they use, becomes weakened. And so men can usually get the erection, but they can't maintain it because there's what they call venous leakage. So the blood gets in, but it goes, and so they get really discouraged. So there's several ways of treating that in addition to the Viagra, Levitra, or Cialis. And that's through lubrication, auditory, visual, and tactile stimulation. So Alex Comfort, the guy who wrote The Joy of Sex, had that in his book, that as people age, they have some of their most satisfying sex because they take the time to caress each other and they have foreplay. They have to have the tactile, the visual, the auditory if they're going to maintain the erection. So it's, I know there's lots of subjects out there, you know. There's lots of things happening in the world of diabetes, and it's never been a more exciting time.
Keith, this has just been great having you on the show.
I'm very proud of you.
I'm proud of you.
You've done a lot for the patients.
All right, thank you very much.
Thank you.